Good afternoon. This is Peter Thomas, General Counsel of the NAAOP, the National Association for the Advancement of Orthotics and Prosthetics. There's been two recent very exciting developments in Washington. The first is that the Congress passed a Medicare bill to fund the physician fee schedule and to do so for one more year until March 15th, 2015. That means that the physicians will not receive a 24% cut in their fees, and PTs, OTs, speech therapists will continue to be paid under the physician fee schedule at the current rate rather than getting a huge cut along with the physicians. It also extends favorable treatment to the outpatient therapy caps, and it does so in a way that does not in any way cut or change policy with respect to orthotics and prosthetics. There were concerns, as there always are, when Congress legislates bills that cost money, that they will offset the cost of those changes through other reforms. And orthotics, prosthetics, durable medical equipment, and all providers are looked at and oftentimes are at risk of being cut in one way or another. I'm happy to say that they didn't do that to orthotics and prosthetics in this most recent bill. And it puts into next year a pretty major Medicare bill. They're looking to fix the physician fee schedule on a permanent basis rather than coming back to this issue year after year after year. And so that does present an opportunity for us to put forward proposals that will be favorable for the orthotic and prosthetic profession. Of course, it also raises the specter that they may wind up seeking some cuts, and so we need to be vigilant as that debate unfolds. The other major issue that's occurred just this week is the OMP Policy Forum. Practitioners from all over the country, over 100 practitioners, came to Washington for actually 3 full days and learned about OMP policy. We had all kinds of practitioners and patients and students go to Capitol Hill. AOPA obviously was the host and sponsor of the OMP Policy Forum, but there were a number of people that participated in that event and held multiple meetings on Capitol Hill, held a couple of fundraisers for our real friends in Congress who are helping. And overall, I think there was a significant energy that came from the OMP field that was imparted on Capitol Hill and the federal agencies, particularly CMS. The OMP Policy Forum focused on a number of different pieces of legislation, and I'm proud to say from NAAOP's perspective, one of those bills was the VA Bill of Rights, the Injured and Amputee Veterans Bill of Rights, H.R. 3408. We continue to work that legislation and try to move it forward. We've got 36 co-sponsors at this point, which continues to grow, and we are working with the VA committee and the House side in particular to try to advance the bill. Also, the OMP Medicare Improvement Act, we've secured additional support. We're moving forward to try to advance that bill as best as possible and to try to put that in a position for being attached to a Medicare vehicle sometime down the road. And then finally, we discussed some new legislation that the OMP Alliance, in coordination with each one of the Alliance groups, including NAAOP, have drafted, and that involves a reform to the appeals process and to the recovery audit contractors. And it essentially does a number of things that would help the orthotic and prosthetic field. In particular, it would explicitly state and settle once and for all that the orthotic and prosthetic practitioners' clinical notes are part of the medical record for purposes of determining medical necessity, and that alone would materially advance the situation with respect to RAC audits and other audits of the OMP field. So thank you so much for listening, and we look forward to our next webcast.